Hi, Nora.
Hi, Peter.
How are you?
I'm all right. And how are you?
Okay, good. Nora, you don't have to. It's interesting with you're in the dark, aren't you?
Yes.
And can you, since I'm trying to find out some information about the drought in Zambia and the effects on Lusaka, can you explain what time of day it is, and why you're in complete darkness?
Okay, so this is 7 p.m. Actually, 4 minutes after 7 p.m., Lusaka, Zambia. And I am, or rather, almost the whole city is in complete darkness because we are having load shedding. That's a lot of hours of no power supply. So recently, our electricity company announced that they would be somehow rationing the power, like 3 hours of supply, especially in the capital city, Lusaka, where the population is highest and there's a lot of demand. But that 3 hours, they've actually failed to meet the 3 hours supply. For example, today in my residential area, we only had 2 hours of supply, and now people are having as little as 30 minutes of supply, sometimes under even 20 minutes. We are having literally the whole day no electricity because the levels of water in the Zambezi River, and of course the dam hydro power station are low. That's the background to our situation right now.
And Nora, thanks for that. And I've done a little bit of research on the most current statistics, and it looks like the 85% of your electricity is hydro, and you're in a historic drought. If I'm not mistaken, you haven't seen conditions like this for over 40 years, likely due to climate change. It's lowered the water levels. That impacts the generation of electricity. That impacts you living in the capital city, Lusaka, and I know that you're working with ROCKBlue, and I know that you're also helping your compatriots at Lusaka Water Supply and Sanitation, the utility that serves over 3 million people. Have you any idea what sort of an impact this load shedding and the fact that they're only getting a few hours a day of electricity, what impact this load shedding is having on the utility and their ability to provide water and sanitation services to the capital city?
Okay, so first and foremost, the supply itself is disturbed. They can't supply if they don't have electricity to pump the water. I might just not be too sure, like if of the alternative sources of power that they have, but traditionally it's heavily dependent on electricity. I know the government has recently announced that they are going to help government, quasi-government institutions to with a fuel or diesel powered power sources. As far as I know, I don't think this has been done yet. So in Lusaka, you find that most of the residential areas cannot actually even receive the water that they're supposed to be supplied with, meaning that residents will not pay because most of them are metered and they pay according to what reaches the end consumer. So they will not pay for a service which they are actually not receiving. And additionally, people become the unwillingness to pay increases even in incidences because the supply is just so erratic. And of course, it affects productivity as a whole. You end up paying workers. You know, Lusaka has a lot of I wouldn't call them casual workers, but maybe hard manual guys. I think there's a lot of manual work involved. So they won't actually be productive because the main resource that their work is surrounded with is not there for them to do the work. And yet, at the end of the month, they'll still expect a salary. And the revenue has reduced. So, where does the organization or the utility get the money from to pay these people? So I think it's affecting the utility in many ways, of course, and they, of course, they have to look for perhaps external resources to ensure that they can find alternative power sources, and it's not going to be cheap for them. And also we know that already their financial position is not something that they are on top of. So I don't know, maybe it could also mean that they have to shift their expenditures a bit, and their priorities have obviously shifted right now.
Nora, thank you for that. If you can imagine yourself in some of the more informal settlements of Lusaka, and obviously Lusaka has a population in the millions, multiple millions. If you can imagine yourself in the informal settlements there, and because of the lack of water supply, you're actually not getting piped potable water. If you can imagine yourself in that situation, what are you going to do for water?
Unfortunately, especially in the unplanned or initially unplanned settlements we call peri-urban settings, where actually the bulk of the population or most of the population of the city reside, people resort to shallow wells, which we know have unsafe and untreated water. So even those that maybe through a lot of sensitization from Ministry of Health, also Lusaka Water, Ministry of Water, had stopped fetching unsafe water. You may recall that Zambia recently went through some serious cholera and very high cholera cases. Incidence of cholera was high. So we are just moving from a period where people were being told not to use unsafe and unclean water. But now, if the safe water is not available, you literally force people to go back to those sources. And also some kind of abuse for those that may have boho. They start selling that they may have their personal boreholes, start selling the water at, of course, unreasonable or high prices that people cannot even afford for the whole usage. But it affects their productivity in the homes, because instead of maybe children going to school, they have to fetch around for water. It disrupts their livelihood sources, where a person is, for example, maybe supposed to be running a small shop or a salon. They'll spend their time fetching water, and even some of those businesses cannot operate without water. I've seen quite a number of business houses are already shutting down because not just the water, but mostly also the electricity. They can't run without electricity, meaning people's incomes in the homes has reduced further from what it was, and we expect poverty to increase.
And Nora, I mean, can you imagine yourself in these informal settlements that you referred to as the peri-urban? Can you imagine yourself as a young mother with a young child, maybe a newborn or a young child, and the only source of water you have for your child is those shallow and contaminated wells, but yet you still have to give that to your child, and you don't know whether or not your child's going to get sick, and you don't know whether or not, if your child gets sick, if your child is going to survive. Can you imagine sort of the emotional, if not other types of pains that mother will be going through with this situation?
It's something that I've already, I think, started imagining, and it's a terrible situation, Peter, because what we foresee are cases of the same, a lot of diarrhea-related cases will spring up because of insufficient water for proper hygiene behavior and practices. Talking of the informal sector, these are places that normally have common places for fetching water, but also public toilets in some cases. So just imagine a situation where maybe 5, 6 to 7 households are sharing a toilet, and you have no proper water to ensure the cleanliness of that place. and responsibility is very difficult. So who will be responsible for fetching water among the 7 families, not people, but families, and the average size of a family is 6 people. So you can imagine the demand on the toilet or the bathroom. And in the case of a baby, it's sad. I was already, while you were talking, I was thinking, if I were the mother, of course I would know I would have to treat that water or boil that water. Normally in the clinics, at least the mothers are educated about ensuring that they are using safe water, but chlorine for treating the water costs money. And also boiling, the primary source of alternative source of power is charcoal, unfortunately. And now the charcoal prices have doubled, in some cases even doubled more than twice, because of the high demand, and there are even shortages in some cases. So if a mother cannot afford that expensive charcoal and all the chlorine, she might have no choice but resort to that water which is safe. And of course, we know the results will be disastrous. And even our clinics in those areas, they are not, I don't know what you call, the ratio of maybe like 1 doctor to the number of patients is not the normal or ideal case. So if we had such an outbreak, unfortunately, it would lead to a loss of lives. If you are aware, for example, when we had the cholera situation, clinics need to be set up in a stadium because we could take up all the cases. So that's how bad it is for us. So our hospital facilities and services are not even enough to meet a demand should we have such a situation that there's an outbreak of diarrheal cases or something of the sort.
It's hard for me to even imagine what that's like. It really is. And obviously it troubles me to hear that too. Nora, you also represent perhaps the middle class or upper middle class of the residents, I assume, in Lusaka. You're well educated, you're very bright, you've held a number of important jobs. Can you tell me, for someone even like you who has more means than other people, can you tell me what this drought and the lack of electricity and water has meant to you personally and professionally?
For me, in general terms, it affects your entire expenditure and resources in a home, because you have to, okay, I'll begin maybe from things like consumption. The refrigerators are not, definitely not working. So you cannot stock up as you'd normally do and buy things economically. It's like it's a daily purchase. So you spend more on the transport, and it's even difficult to plan, maybe for a month and organize your resources, because the fresh produce will go bad. So that is for starters. Then secondly, also, you have now to resort to other supplies. You have to procure at least lighting systems in the home, which you didn't need before. And talking of maybe in professional terms, in my case, I work from home. So it affects my own workflow and productivity, because if I don't have electricity, then my computer, my phones are not functional. So generally, people now have to procure, those that can afford to do so, procuring solar panels and other things, which means you've shifted your resources to something else that you should not have bought, or you end up looking for other means to meet those demands. in general terms, I think life just becomes a little more harder because it's the two basic things that you don't have: no water and no electricity. So I think life has just become more difficult than it would otherwise be. Even in terms of livelihood within the homes, I mean, there are people that, from the class you've mentioned, there are people whose livelihoods also depend on what they can do for, I'll talk, for example, maybe those that are also running businesses that are dependent on electricity, for example, internet cafe or something of the sort. Most of them now have to either close or source for funds to buy a generator. But of course, we also know a generator comes with daily operational costs of diesel and all those things. So it's affected everything, including the schools. What can I say? All of us have to change our way of lives and survival in one way or another.
No, that answered the question. I mean, you paint a very vivid picture of what life is like, even for you. And then imagine what it's like for others who have less means, less opportunities than you have. If you had to close this interview, Nora, if you had one thing to request of those around the world who they care about Africa, they care about their fellow human beings, what might that request be of them?
My request, I would start with those that are attainable within the quickest period, because this is a crisis, so to say. Even though I don't want to sound political, but our leaders are not, they don't see it as a crisis, or at least I've heard and learned from interviews and discussions going around. But mostly, I think what could be done within the short frame is it's a lot of behavioral change on our part as citizens. I think what will help us the most is what we can do with what we have right now on our own. And I think that's shifting, especially from the dependency on electricity as the main source of power. It's something that our country has never really gone through. So it's a new experience that calls for a lot of awareness raising. And I feel there's still solutions that even I may not know, which the external world, especially the Western world, would know and also help us with. So for me, I think it would also, in the usual work, for those that are already working in Zambia in one program or another, if they could integrate or mainstream deliberate awareness raising that is related maybe to survival and resilience to what is happening right now. That is the first step, because I can talk of, for instance, now they're talking of setting up is it a solar generation plant or something. That's not going to happen in a month or 2 months. So we need immediate solutions to help people survive right now and cope with the times. But of course, I also brought in, or you asked me about safe and unclean water in those areas. If we have, I'll call them cooperating partners, that could help, for example, Lusaka water, supply maybe free water through browsers and the like to some of those critical areas where people cannot afford to put up their own bores, but at least they have some access to water. That will help to stop or even prevent the spread of diarrhea diseases right now, because that is where we're going to get to. And any other energy solutions that could be available from some advanced technology countries, I think that would also go a long way. And if you could have partners maybe that could help deliver such to people that cannot afford that could help. But I think the most critical thing is measures that we ourselves can take in the interim while we are waiting for the bigger solutions. And of course, we also have to think of Lusaka water, and not just Lusaka water, but of course all the 11 water utilities that we have in Zambia, how they are going to survive through this period, not forgetting the electricity company, because unfortunately some people might even end up losing their jobs because they might become redundant if you set up other power generation plants and that kind of thing.
Nora, really, you've painted such a good and clear picture of what the situation is like for others who are outside of Zambia. I just want to conclude, I know this is you don't like doing this, but you are a humanitarian. You are also a volunteer. Can you just very briefly introduce yourself, your name, but most importantly, the work that you're doing right now to help people in Lusaka and actually throughout Africa?
Okay, so my name's Nora Idonije, and I'm working as a utility partnerships coordinator for ROCKBlue, and I also work as the local resident representative for Lusaka Water and Sanitation Company, which happens to be the biggest water utility in Zambia, in our capital city, Lusaka, and also serving some other towns. So my role is to ensure that ROCKBlue delivers the much needed technical and advisory support to the senior management of the water utility, that's strengthening their capacities, but also building bridges for them to access the much required financing, and also strengthen their skills in different aspects as is identified through different processes that are undertaken. And in short, I think it's all about helping the utility to become more financially viable, resilient to emerging issues that may arise, climatic conditions such as we are going through now. And I think a lot of sustainable measures in ensuring that their processes are improved, processes that make them more efficient as a service utility, improve their image, and also make them a learning example even for other utilities that may not be working with ROCKBlue. Awareness raising through the work, but also as we empower those managers within Lusaka Water, the utility, and the technical people, we know that those expertise are also trickling down to the actual beneficiaries. And at the end of the day, I think it's felt at all levels of the system.
Nora, thank you sincerely. I really appreciate your thoughts, your time, and the heart that you have for the work that you do for others.
Thank you for the opportunity, Peter. Love working for ROCKBlue, and I believe we're making an impact that will become larger and larger. And I believe Lusaka is feeling that impact, and I'm very glad that they are receptive and they know that the work ROCKBlue is doing is going to change their lives and their work for good.
Okay, Nora, have a good evening, be safe, and I hope the electricity comes on soon. Thank you again.
Thank you. Sometimes at 2 a.m.
Okay, bye, Nora.
Thank you. Bye.